Good afternoon, everybody. Today's May 22nd. Happy Friday to everybody. This is our weekly COVID update. My name's Scott McGann. I'm the health agent for the town of Falmouth. Our website for the most recent information is falmouthmass.us. To email the health department directly, it's health@falmouthma.gov. And our phone number is 508-495-7485. We'll do the best we can to get back to you as soon as possible. With the Governor Baker's reopening starting next week for a lot of businesses, it's going to be a very high call volume. We'll do the best we can to get a hold of everybody. So let's get into it. The first thing is we're currently, as of last night, 174 cases since March 1st. Over 80% of the cases have recovered and are out of isolation. As with the rest of Barnstable County and a lot of municipalities, most of the cases are related to long-term care or congregate living, both the residents and staff. Unfortunately. VNA, with the support from the health department, continue to perform isolation and contact tracing. That's going to continue indefinitely. And we do the best we can to get a hold of everybody and make sure that we've got everybody isolated and quarantined as needed. Falmouth's about 14.5% of all cases, and about 14% is expected. Our highest was early in April at 23%. If you look at our weekly case trend, you can see the last week or so, we're a little higher, closer to 20 per week, as opposed to being down towards 10, 12 a week. Primarily, that's because of the issues we're having at the long-term care facilities. We do get, when we look at these, a lot of them make sense. They might be, new cases might be a close contact of an existing case or a long-term care. There's still an occasional couple of cases a week where it comes from a community spread or a random sort of case where it doesn't really have a simple explanation, such as being a household contact or a resident or staff of a long-term care. So we do get a few of those, but for the most part, that's where we're at. So the trend is a little higher in the last couple of weeks because of it. Our tests since the beginning, you can see that we're sort of in a path with a slight increase. And again, that's primarily because of what's happening at the long-term care facility here in Falmouth, one of them. If you look at our infection rates, this is a good indicator of how we compare to the rest of the state. Falmouth is somewhere currently around 550 per 100,000, where the county is 560 per 100,000. The state is about 1,289 per 100,000, so we're about 2.3 times less than the state average for cases. So Falmouth's on the better side of an infection rate compared to the rest of the state. Looking at all the different counties, I bring this every week. Again, this is at the state's website. We'll get into detail. They've changed their website around, their dashboard daily. It's pretty good. So the first one here is you can see the blue arrow facing with Barnstable County with 1,202 cases. I think the county's right around 99, 98 deaths associated with it, and there are 1,200 cases. And you can see that our line has been relatively stable for some time now. This is the new dashboard. And if you see the red light, green light, yellow light going on, these are going to be the indicators of how the reopening plan goes and whether we progress from one phase to another. You want to obviously not see any negative trends. And it's the test rate, the death rate, the hospitalization rate, the healthcare readiness system, basically any hospitals that might be on overflow or full, the testing capacity, and our ability to contact trace. Okay, so those lights, you want to see them all green with occasional yellow, and that's how we'll move on between the phases. And you can check this again between 4 and 5 generally every day. And this is one of the first pages on the dashboard, and boom, you can look at that real quick, and that can tell you how we're making out. As far as yesterday, the new cases were 1,114. New tests reported today they did 12,000, almost 11,500 tests, 82 deaths. It leaves us at a total of 501,000 tests completed, which, if our population, I think, is 6.83 million. I Googled that, and it's about 7.34% of the population has been tested, with 1.32% positive. These are the trends that we want to see go down. This goes back to the green light, in green light, yellow, and red light. You can see since April 15th, we're 67% down on the 7-day weighted average of positive test results. Again, in my past ones, if you've seen any of the past ones, I say the hospitalization rate's really key because it's a very consistent number. Same amount of people from day one all the way to whatever day we're on now has been, when you go to the hospital, is a relatively stable number, whereas your testing goes up and down, your volume of testing goes up and down. And we're down 31%. Let's say May 1st, we were at 3,707 hospitalizations. We're currently at 2,462. So that's a 31% decline in hospitalizations since May 1st. Hospitals using surge capacity at the beginning of May, we're at 23. We're down between 13 and 15. That's just a 29% reduction. And the 3-day average of deaths is May 1st, around there was 150 to 160, and we're down around 80 to 90 cases of deaths, which is a 47% drop. So those are all good indicators. And in my second half of the talk, I'll be spending some time about the reopening. Partial reopening. Again, by county, we've been hanging steady. We're doing fairly well as a county, and so that is also on the dashboard. The number of deaths, right now you see where I've circled the trend is definitely the reduction in hospitalizations, and I always told you that's the key number. To me, it's one of the most important numbers. We currently have, somewhere around 24 hospitalizations, about 650 in ICU. Long-term care facilities, the numbers are pretty much the same. The 61% of all deaths have been associated with long-term care facilities. About 21% of all the positives come from long-term care. We're increasing testing. There's a lot more, let's see, the Barnstable County at 4Cs is doing the testing with Cape Cod Healthcare. We're averaging between 60 and 100. Now they're averaging about 150, and it's from a lot of increases in testing of people that work at long-term care. We're trying to get real aggressive at the testing and trying to catch it. Because occasionally somebody who's asymptomatic may not show on the first test, and it takes the second test. And the more we can catch it, and the quicker we can catch it, the less chance that we have an asymptomatic person working there. Okay, so we can see that our nursing homes are still about the same as last week. There are obviously been some increases, but they stay among 10 to 30 or less than 10, based on which one of the three sites that I have listed here. By hospitalizations by Barnstable County. This is on the Barnstable County's website because you can visit that every day. That's updated as well. You can see that the Falmouth Hospital as of the 17th was 8 and 3, 8 in ICU, 3 in ICU, 8 total. And it does fluctuate, 5 and 1, 8 and 3. It goes up and down a little bit, but it's definitely better than the 21st and the 28th where we were in the teens, roughly. And so the counts are doing better at our hospitals. A call I was on yesterday from Cape Cod Healthcare was on it, and they did say that they are doing fairly well with low hospitalization rates. And again, of course, that's a credit to everybody who lives here and lives on the Cape, because the social distancing is what's kept these numbers down. And people taking it seriously and taking to what our health officials and what the state's been saying, and that's the reason why these numbers are on the downward trend. The testing, again, continues at 4Cs, drive-through Monday through Saturday, and your physician will determine the need for a test. And if there's any changes to that, then I'll have it on my next one. I've asked to see if there's going to be any changes, opening it up maybe a little bit more, but that's where we're at now. And that's for your real swab test, checking for actual virus, not necessarily, this is not an antibody test. All right, a little bit about the reopening. There's a 4-phase approach. Last week we were in the current stay-at-home. The next one is the start, which is going to be limited industries resume operations with severe restrictions. That started on the 18th, with most going on to the 25th of this month. Phase 2 would be cautious, with additional industries resuming operations with restricted capacity. And then we go on from there. Now, each phase will last a minimum of 3 weeks. So the earliest phase 2 can start would be June 8th. And so they're going to be based on whether the red light, green light, and yellow light on that front page. So if you think of it, you can check it on a daily basis, and that trends need to be good, and that way we can get out of each phase and progress. We can also go backwards. So, for example, I'll get a little ahead of myself, that in phase 2, if it's a food establishment that can have seating, a dine-in seating, a restaurant, they may go back to phase 1 if the numbers don't look good. So it's all going to be data-driven. And so going into a little bit more detail on it, the reopening in phases is going to really, what's going to be important is the social guidance, the covering your face, frequent hand washing and hand sanitizing, the social distancing, not coming to work ill or staying home, not going to any place if you're ill, calling a physician, staying home if you're sick, okay? There's going to be special guidance for high-risk people should work from home if possible, priority consideration for workplace accommodations. They should have the priority, all the way through phase 2. So it's really going to depend on what happens, but definitely want to protect our high risk. Gathering size in phase 1 will be less than 10, so it's going to remain less than 10, at least till June 8th. And then it'll be determined based on trends, and that's going to depend. So a lot down the line is going to depend on what's happening during phase 1, okay? Now, it's called Safer at Home Advisory, so you still want to limit the amount of travel outside your home for non-important things. And then, of course, all travelers are urged to self-quarantine for 4 days upon returning. And that stays into phase 2, all the way through phase 2. So the start of it, so May 18th, essential businesses that are already open must be self-certified. And what there is, and I'm getting a little ahead of myself, is there's a self-certification. And a couple slides will say what that is, but there's some guidance that has to be followed for each type of establishment. Manufacturing, construction, all construction, worship, hospitals and community health centers who attest to specific public health safety standards can provide high priority preventive care, pediatric care, and treatment for high-risk patients. So that's into place now. On the 25th, laboratory and life sciences, office buildings, other than those in the city of Boston, which you have to worry about. Work from home strongly encouraged. Businesses should restrict workforce presence to 25% of maximum occupancy. Not necessarily you have to reduce your staff to 25%, but based on occupancy, which can be quite a difficult number to get. It's not an automatic number. If you're a newer building, perhaps the building department may have that number. Otherwise, you may have to find a private party such as an architect or an engineer or someone to help figure out what your maximum occupancy is, because it really depends on the age of the building and a lot of other things. And so it's not necessarily just an easy number. But for example, if you have a huge 10,000 square foot building with 4 people in it, doesn't necessarily mean you have to go to 25% of the 4 people. It's going to be based on what your max occupancy is going to be, which is going to be a difficult number. But that's what the guidance is. Hair salons and barbershops by appointment only on May 25th. Again, they'll have to self-certify, and we'll talk about that in a second. Pet grooming by appointment only. Car washes, exterior car washing allowed. Certain types of recreations with guidance. And other types of healthcare providers. And retail can do curbside pickup, so all types of retail. So there's very specific, if you own a business and you're listening to me and one of these affect you, go on mass.gov's reopening website. Okay, just Google it, or whatever your preferred method to get there, and look at your detailed for each one. If you own a car wash, there's specs for doing that. Hair salons, there's details on each one. Okay, and what they'll look like is, this is for manufacturing, for example. This is from the website, but there's going to be checklists for cleaning and sanitizing, staffing, hygiene protocols, social distancing protocols for each one of the different industries that are looking to reopen. So if you're a hair salon, go on to the hair salon ones and so forth, and there's lots of detail on it. The health department's not going to really write these for you. They're to be right for yourself. How it works is the health department will deal with complaints. The Division of Labor Standards and the local health department, I can guarantee you it'll be the local health department. Somebody from the state probably would not be coming down. We'll be following up on complaints for not following these procedures. If you're an employee who wants to see what they are, you can go on the website and see what your employer needs to do in order to comply. Okay. It's going to be a lot with social distancing and maybe reconfiguring office spaces, keeping spacing correct, face coverings for employees, signage, hand washing capabilities, hand sanitizing capabilities. Touching work surfaces, sanitizing work surfaces is going to be important. How many people and where you're going to have them in the room. How you're going to clean and sanitize and disinfect common areas, bathrooms, and so forth. So it's all on there. I don't want to go into detail during this talk, but if you have specific questions, you can give us a call. So phase 1 is what we talked about on the previous slide. Phase 2 is going to come in no earlier than June 8th with restrictions. All of it's going to be restricted. Hotels, motels, and short-term rentals, dine-in portions of restaurants, because they're already allowed to do takeout, curbside, nail salon and other personal care, rec camps, recreational day camps, certain types of youth sports, inside library access. Those will all be in phase 2, which, again, we need 3 weeks from, so no earlier than June 8th. Moving on to phase 3 would be more like movie theaters, gym, fitness centers, museums, bars, concert halls, bus tours, whale watching. There's a long list. And then phase 4 would be a large gatherings such as a Patriots game or stuff like that would be more towards phase 4, and we'll move back and forth as the data shows. So nice to say it's encouraging that we're starting to do the reopening. I encourage all businesses or people that are going to go back to work and they're concerned about their individual business that they could go to the websites. And any specific questions, you could call the 211 number from the state, or you can call the health department. We'll do our best to get back to you. We are starting to get the calls in real hot and heavy as of the last couple of days, and we do our best to answer everybody's questions. But it's relatively straightforward, and again, the health department's only going to deal with complaints on it. Beaches. So everybody wants to know that the 8 parking lot beaches will be opening Saturday, May 23rd, yay. Parking attendants will be present to control and monitor the beaches. No fee for charging until June 20th, so you'll need a beach sticker at that point. Beginning, we're going to start at 50% parking capacity, and that's going to help keep the social distancing at the following beaches: Old Silver, Chappie, Wood Neck, Surf Drive, Minot East and West, Falmouth Heights, Bristol, and Goodwill. Actually, McGann as well, because the boaters are having a hard time backing the boats in. So we're just today decided to figure out a way to have McGann figured out, open, so that the boaters are having a hard time doing the turnaround if you've been to McGann. And then by June 20th will be MBL Stony. And then the Quistit Harbor Knob, we're going to reopen the parking there, and police will enforce illegal parking. So the beaches are opening back up starting tomorrow. Again, the signs you'll start seeing up is 6 feet apart. Keep groups of 10 or less. Try to keep your lawn chair or your blankets 12 feet from the nearest person. If you're within 6 feet, a mask. Dispose of trash properly. We're going to do our best to make sure we're doing a great job and frequent as we can on the restrooms when they open. And just be respectful and try to follow the rules. Please, if you... it's real difficult for the health department or the police to keep running down for every time we have a complaint. So it gets real problematic. So we're hoping that everybody can respect and follow the rules so that we're not wasting a police officer's time, or, I'm trying to, instead of, being on Maven and trying to do some work with isolation and quarantine or doing stuff, I'm running down to the beach and so forth. So we're just trying to have everybody be respectful of each other, follow those basic rules, and enjoy the beach. As far as beach stickers, I put a little in. I'm not an expert on beach stickers, but I thought it was not going to be required till June 20th. The town's encouraging purchasing of the beach stickers by mail. You can get it on the website over here, falmouthmass.us 152 beach parking stickers. They'll be sold at the bathhouse on Surf Drive beginning on Tuesday, May 26th. But if you can get it by mail, that's always less, that's less human contact, the better, is what we're looking for. And that's a couple ways that you can get stickers. It's also on our website. There's, I'm sure at the main page of the town's website, the town manager's office and so forth has this all over the website. But I thought it was worth bringing it up because we are starting to get questions about beach stickers. And so I pulled this off the web. Just to recap, the state metrics on a downward trajectory as they have been. And so Falmouth's holding its own, with most cases restricted to the long-term care, has been the trend on the entire Cape and a lot of places elsewhere. So we're starting a slow, methodical reopening in 4 phases. We're entering phase 1 with a minimum of 3 weeks between the phases. And beach parking lots are opening up this weekend. So hopefully we can maintain the social distancing and keep the counts really low. Again, like I've said in a lot of these past ones, that it's really going to be about the counts and how well we're doing statewide before things are slowly opened up. And hopefully we maintain a good trend. And thank you, and I'll see you guys next week.